On my 23rd birthday, I did meth for the first time. I lost my son 2 days later, and that was really hard. And then from that point, I just went on the streets, and I didn't care about anything.
These are individuals that are at the absolute bottom. Their experiences in life have just brought them to a point where oftentimes they're just hopeless. And they just assume that they're going to spend the rest of their lives in prison.
How do we get to the point where we can say that this person is not likely to engage in that illegal behavior anymore because we were successful at addressing that addiction?
Some of the communities that are just most affected by incarceration are communities that really have very few other resources out there. Jobs are in short supply, education is not of very great quality in a lot of cases. There are very few other ways for people to get a change into their life.
I didn't really have parents growing up, as part of the system. I mean, I had parents, but they weren't mentally there and sometimes physically not there. I had been in and out of juvie as a child, which started with truancy. I got pregnant at 15, married at 16. Between that time, I got arrested like 30 some times, and as it progressed, I got a worse drug problem. My charges kept getting worse and worse.
We understand that the population that encounters the criminal justice system comes in for different reasons. You have people that are coming in for violent offenses, and then you have a large number of people that are coming in for factors that are more related to mental health. The reality is the criminal justice system is ill-prepared to deal with those types of problems.
Treatment Alternatives and Diversion in Wisconsin started as an idea that came out of a legislative committee in 2005. It said the client population who are alcohol and drug involved offenders, who are involved in nonviolent crimes, can be referred into treatment programs.
The Treatment Alternatives and Diversion program was really predicated on having some kind of an assessment early on in the process. If the people were appropriate for assessment, diversion, and placement in resource-rich environments, there would be a benefit not only to themselves, but to the system.
The one thing that we heard over and over again was that for every person we get into this program, there are 20 we don't. What would happen if it was fully funded? So we reached out to human impact partners about the potential of doing a health impact assessment related to alternatives to incarceration here in Wisconsin. So the community was involved in a variety of ways in doing the HIA. We had groups of people all along, kind of very representative, kind of very broad, diverse groups of people helping to shape the process from the very beginning. The coalition of people working on our end is our own membership, which is a very diverse interfaith organization. We also included some of our partners who are involved in agencies and in serving organizations. And then very importantly, we got the formerly incarcerated community very much involved, who really loved having the chance to be able to tell their story and to tell what it was that helped them become whole again.
I changed my life. Somebody cared about me. Somebody invested some time, some heart, and a couple bucks. And now I'm standing in front of you today, bragging about how I got my son back, bragging about how my life has changed. I'm not in jail. In fact, I'm helping people that don't have a voice in jail. It's almost like a miracle. It's like you're a whole person, not like this jaded, angry, drug-addicted person that is very unstable. You're a mother, you're a normal person.
The thing we're most proud of is that we got a 400% increase in the TAD program directly because of the work connected to the HIA. The combination of getting a lot of people mobilized and having the good data actually caused a legislature in a very difficult budget year to make the decision to increase funding very dramatically. And that means concretely almost 1,000 people a year not going to jail or prison.
It has allowed for an educational process to occur that has better integrated the discussion of justice system and justice system clients with the healthcare system. It has made it okay for both sides to really talk to the other.
Anybody suffering from drug addiction, alcohol addiction, mental illness is not going to benefit from another criminal conviction. But as long as there can be accountability with some sense that the person is going to get what they need to stop engaging in the behavior that brought them here in the first place, it's a win because it means we're not going to have more victims in the future, and it's a win because that's a person that's not going to have these enormous amount of criminal justice system resources invested in them when we can safely address the problem in the community.
My son is Isaiah. He's very handsome. He's gonna be 9 next month. He lives with me full time now. He's just an innocent, beautiful child who just says things that just blow my mind. He'll say like, you know, yeah, you were young and you made mistakes, but people when they grow up, they get better. Everyone should have a second chance. When it works, you save a life. And when you save one life, the ripple effect of that is saving my son's life.